guys, welcome back to Wisdom Tooth Wednesday at Nothing But Wisdom Teeth. One of the most important things after having your wisdom teeth taken out for a good recovery is aftercare. Following your post-op instructions to a T is very important to avoiding any complications after wisdom tooth surgery, like infection or dry socket, which we'll post some videos later on this year on those things specifically. So today we're just going to go over the highlights of pre and post-op instructions. All these can be found on our website, nothingbutwisdomteeth.com, which should be linked below on the patient's page. If you're a guest in our office, we make sure to go over all pre and post-op instructions at your consultation before your surgery, so you're all prepared, all questions are answered, so there are no surprises on the day of your surgery. So, starting with pre-op instructions regarding sedation, no food for 6 hours prior to your appointment. You can have clear liquids up to 2 hours before. We do surgeries usually in the morning, most people do, so you're pretty much able to just eat a really good dinner the night before and stay hydrated throughout that night and up to the 2 hours prior to your appointment. You can have clear liquids like water, Gatorade, stuff like that, nothing too heavy. So staying hydrated up to those 2 hours before can really help with placing the IV. If you're way too dehydrated, it makes it a lot harder to place the IV, and we wouldn't want to have to reschedule an appointment. So that's very important. On the day of surgery, just wear comfy clothes, a short sleeve shirt that doesn't tuck in. You might want to bring a small blanket with you because you might get cold. No contact lenses, jewelry, or fingernail polish. We get a lot of questions on why no fingernail polish. It's usually the darker colors like black or brown that the pulse ox reader, which is this guy that we keep on your finger to monitor you throughout surgery. Sometimes he can't read through black or brown darker colors, so we just say just take any polish or fake nails off if you can. So that's what that's for. You will have to have an escort. We just ask here that you check in about 5 minutes prior to your appointment, and they're going to sign a release saying they're driving you home, because if you're being sedated, you're going to be pretty wobbly and a little disoriented when you leave here. Post-op regarding the sedation, you will have to have that escort drive you home and keep an eye on you for about 6 hours after your sedation. They're going to need to support you under the arm when you get out of the car, keep an eye on you. You're probably just going to want to sleep most of that day afterwards, which is fine. No driving or intense physical activity the rest of that day. I like to tell people to try to avoid making any important decisions the remainder of the day after you're sedated. Post-op regarding the actual extractions. The recovery period is about 5 to 7 days for most people. Day 3 can often be the worst as far as pain and swelling, so don't be surprised if you get home and the next day you're like, oh, that wasn't too bad. The pain can spike on day 3, which is normal, and then it should start to go back down from there. If you have surgery on a Friday, usually people are back to school or work by Tuesday, possibly Monday. Everybody's a little different. Just rest as much as possible for the next couple days. The first 24 hours when you're sleeping and lying down, just stay kind of propped up on 2 pillows or sleep in a recliner or something like that, and rest as much as possible for those next 48 to 72 hours. That's going to really help your body recover. We'll send you home with extra gauze, but you probably are going to want to pick up some extra gauze ahead of time too. You'll bite down on that firmly for about 2 hours afterwards. The main bleeding is 2 to 6 hours. You can see some slight oozing from the sockets for up to 2 days. Sometimes a little blood mixes with saliva and it makes it look like more blood than it actually is. You're also going to want to start ice packs the first 48 to 72 hours, frozen peas or actual ice packs like this guy from the store. This is a pretty hard one, so the softer ones are usually better. They form to your cheek. You're gonna just hold them on the sides of your cheeks, 20 minutes on, 20 minutes off. And then the 3rd to 5th days, you're gonna do the same thing, but with heat. So I like to just get a little washcloth, run it under some water, get it damp, and then pop it in the microwave for a couple minutes. That gets it nice and warm. That's all gonna help with the bruising and swelling. Salt water rinses for the next 5 to 7 days. No rinsing for the first 24 hours after surgery. Start your salt water rinses on the next day after the 24 hours. You'll rinse with the salt water for about 10 to 15 times a day. You'll get about a cup of really warm water with about a teaspoon of salt dissolved into it. You're just going to pour it in your mouth, tilt your head from side to side so that water gets in all the sockets to clean them out, and then just lean over the sink and let it fall out of your mouth. It's kind of gross, it's not very pretty, but we say no forceful swishing, spitting, using a straw, definitely no smoking for the next 5 to 7 days. All those forceful motions can cause the blood clot to come out, and that can lead to a dry socket, which is the painful part you hear about sometimes after wisdom tooth extractions. So, also we will send you home, or whoever is doing it will send you home with a plastic syringe like this. You can see it has a little curved tip, so you're just gonna backfill this with your saltwater solution, like we just talked about, and say this is the hole where your tooth was. You're just gonna stick that tip right over the socket and use it to flush out any stuff that gets caught in there. But you're not gonna use this guy, the Monoject syringe, until day 5. Eating is one of the biggest questions we have. Liquid or soft foods for the next 5 to 7 days after surgery. Focus on eating things that don't involve a lot of chewing for that time period. Smoothies, milkshakes, mashed potatoes, stuff like that. And no straw. Nothing too hot or spicy or with little bits or seeds that can get caught in the sockets. At our office, we usually send you home with 4 main prescriptions. You'll get a painkiller, an anti-inflammatory, an antibiotic, which you definitely need to take until it's all gone, and then an anti-nausea medicine if you do feel nauseous. Sometimes people feel a little nauseous after surgery or sedation, but if they do, it's usually from the Norco, if they're taking Norco. That is about it. When you're taking your medications, we do suggest taking the pain meds for the first couple days and kind of getting up throughout the night, or having someone wake you up throughout the night, setting an alarm so it doesn't hit you too hard when you wake up the next morning. As far as foods, we're going to post a video later on in a couple months that kind of goes over specifics of what foods are good to eat for you guys too. So if you have any questions, feel free to get in contact with us. All the contact info should be on here, linked below, or on our website. And good luck with your surgery. Bye.